Happy New Year, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 601,663 confirmed cases of COVID-19 in Canada and 190,962 cases in Ontario. Chatham-Kent has 706 cases, and Sarnia-Lambton has reported 934 cases. Michigan now has 497,127 cases, with 25,948 cases being in Detroit. Today we are reporting 202 new cases of COVID-19 in Windsor and Essex County. 48 cases are related to outbreaks, 12 are close contacts of confirmed cases, 3 are community acquired, and 139 cases are still being investigated. We have had 8,502 cases since March. 5,809 cases are now resolved, and 2,514 cases are active and being followed by our health unit. 103 cases are currently in the hospital and 15 people are in ICU. I'm sorry to inform you that 16 people from Windsor-Essex have passed away from COVID since yesterday. 13 residents and 1 worker are from long-term care, and 2 people are from the community. Our community has lost 167 people to COVID. 108 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 42 active outbreaks in Windsor and Essex County. 20 long-term care and retirement homes, 16 workplaces, 2 schools, 2 community outbreaks, and 2 hospital outbreaks. Our health unit has been working with long-term care homes to get their residents, essential caregivers, and staff vaccinated as quickly as possible. We are vaccinating our 5th home today and would like to thank all of the staff from the homes who worked so hard to get this accomplished. I would also like to acknowledge our own health unit staff who continue to work with the homes to support this work, from IT to vaccine delivery and immunization. Despite the rollout of vaccine, please continue to follow public health measures. Stay home if you're sick. Limit your close contacts to your household. Maintain a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering, and cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. If you haven't already done so, download the COVID Exposure Alert app at canada.ca. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. I want to start today by saying Happy New Year to all of our viewers and all of the media who's here today. 2020 is a blur for many of us, and I know it has been a really difficult year for all of our people in the region. We lost 145 of our residents to COVID, and I want to take a moment to acknowledge all these lives lost and want to send condolences on behalf of all my team to all the families who lost their loved ones to COVID in 2020. I'll be brief today in my comments today, but want to share the harsh realities right now. Between December 25th and today, we reported more than 2,000 cases. We are starting to see the cases resulting from possible exposure from Christmas Eve and Christmas Day, and even other gatherings that took place before Christmas. We have 20 long-term care homes and retirement home currently in outbreak. That is roughly half of all the long-term care home and retirement home in our region. We have outbreaks limited to 1 floor of Windsor Regional Hospital and also outbreaks at Hotel Du Grace Healthcare. We have Erie Shores Healthcare opening up 3 COVID units in the region. All the long-term care homes and retirement homes that are attached with the area hospital for staffing support, the hospitals are struggling to send their support to these homes, and it has become a crisis now. Our public health staff are following up cases as best as possible, but we have 2,500 and more cases active in our region. In comparison, Sarnia-Lambton and Chatham-Kent combined never even had that total number of cases since the beginning of this pandemic that we have currently active right now. To those who are thinking that I am doing the things safely, I want to say that you are not. At this time, no activity, nothing is safe, and people should strictly follow the lockdown measures as recommended by the health unit and as by the province. If we really want this region to move forward safely, we have to take actions right now, and it starts from every one of us. I want to switch gears now and talk about the light at the end of the very long tunnel. Windsor-Essex Health Unit received Moderna vaccine and have started vaccinating residents and caregivers of long-term care home in our region. We have already vaccinated roughly a quarter of these long-term care homes and are on track to vaccinate the rest of the long-term care home in the next 7 to 10 days. The real struggle will be the long-term care homes that are currently in major outbreaks and how we can move forward with vaccinating them. We are also working closely with the retirement home at the same time to get them vaccinate their residents too. We'll continue to provide updates as needed. Thank you.
We'll now take questions from the media. Today we'll do one question, one follow-up, and we'll start with CTV.
Good morning. I'm just wondering if you're considering extending the in-class school closures past January 11th and when that decision is expected.
Well, we are looking at those numbers very closely right now, and as mentioned earlier last week, we will be looking at the trend and probably will provide a recommendation midweek sometime by Tuesday or Wednesday.
Okay, thank you.
Any questions from CBC?
Yes, good morning, Dr. Ahmed. I think it's safe to say without question we're in a crisis situation. Seniors are dying by the day. When you add in the 16 deaths, I believe we're at 66 deaths in the last 2 weeks. And the health unit had mentioned last week that administering the second vaccine, the Moderna vaccine, would take steps like collecting data, getting consent, training. Why was that not already good to go upon the arrival of that vaccine last week?
Well, good question, Sanjay. I think a lot of that is dependent on what confirmation, what information that we are working on. And the moment we have the vaccine in our building, we did everything to get the vaccine out of the door, and that continues to be the case. And as we know, the supply, the vaccine, it's a new vaccine. When it's approved, you have to also look at all of those factors. And a lot of the work that was happening, that was through the health unit, but we also are dependent on getting this information from the ministry and also getting the information from the long-term care home and retirement home to get them going.
So would you agree it's fair to characterize this as a delay, considering the vaccine arrived last week and we're only starting to use that second vaccine this week? Is it fair to characterize it as a delay? And if so, who does the responsibility lie on for that?
So first of all, I would say that no, it's not fair to characterize it this way. And I think it would be really inappropriate to say that even that it's a delay and it's something that somebody is responsible for. All I can say is the moment that this vaccine is here, you have to recognize what you are dealing with right now. Your region, our region, has the highest or near highest case counts, case rates in the province. You have 2,500 positive cases in our region active at this time. We have 20 long-term care home and retirement homes that are currently in outbreak. You have a staffing crisis in each of these long-term care homes that are experiencing an outbreak right now. Your hospital systems are in crisis because of the inability to provide care for the number of positive cases. So I think it's very easy for people who are sitting on the sidelines, who have nothing else to say other than just to say that what are things going wrong? And I would want to take that opportunity to ask them, what are you doing? Tell me, what is your job? What have you done? And how have you fulfilled your responsibility? So I think I would just categorically say that it's unfair and it's not accurate that there is any delay. And as Teresa reported, We've already have gone down to 5 homes at this time, and as we are speaking, there are homes that are currently getting the vaccine. So whatever needed to happen based on our situation, we're still way ahead of what we could have been. So I think people need to put things into perspective. People need to really look into making any of these accusations. And I would say that, look at yourself, what you have done. 2,500 cases, 2,000 cases since Christmas Eve as a community, what we have done and what kind of situation that we are dealing with. Our health unit staff, and I just want to say it without any reservation, have been working day and night. We've been working more than 14, 15 hours every day. There was not a single day during this entire holiday that none of us have taken up any kind of break. So just to say that, I think it's utterly disrespectful. It's shameful for anyone who's thinking that we are just sitting and we are not caring about it. We care about every individuals who need to get the vaccine, and those vaccines are already out there. Those vaccines are already being administered as we speak, and we will continue to do it based on whatever we have, and we'll finish all the homes as soon as possible.
Any questions from Blackburn?
Yes, good morning. I guess I'm just curious. I mean, as you said, 2,000 cases since Christmas Eve. Were you hopeful that things would have, calmed down since then, since you did close schools a week before Christmas? What do you think it's going to take now at this point to kind of curb this outbreak?
Well, I think what we are struggling here is, as we have always said, that some of these measures need to happen quickly, sooner than later. And the moment we start to take all these actions, it takes some time. Even in the regions who have been before us into lockdown, such as Peel and Toronto, they're also experiencing something similar. And partly it's because of disregard of all these measures. If there is any confusion in anyone's mind, and that's why my message today was very simple and clear, I just put together what we are dealing as a community, and we have heard it from people, and our team has been in contact with all the cases. Every time when we are hearing, oh, I was just doing it this way because we feel that it was okay. No, it was not okay. Plain and simple. I think that's the bottom line. Everyone who is doing something, they think that maybe they are doing it things safely and others are not. And I want to take this moment and say, no, everyone is doing it wrong. The message is stay home. Don't do anything that you don't need to do. You do not need to meet anyone. You do not need to go for any other non-essential visits or anything that you need to do. That's the only way we can bring these case counts to a number that can be manageable for our region, because otherwise we'll continue to see the cases increasing, and we will never get out of this lockdown, and we will never get back to a situation where we will be able to say, yes, the community is safe to open up and it's safe to go back and do whatever we need to do. So I think we just need to be thinking about what's the end goal here, and I want to be careful that it is not me, it is not the health unit who would be responsible for if the cases continues to increase in our region, and if there is any complications or any impact it would have in our community, in our businesses, in our as a community moving forward. It is not us. And I just want to make sure that we need to know we are in the mandatory lockdown until January 21st. We have time. We have time to bring the case counts to a level where we feel as a community that we are in a better position to move forward.
And just on that note, if the cases are on a rise, they are mandatory lockdown until January 21st, then why would children be sent back to class if it's that dangerous that you're asking people to stay home except for necessities?
Well, I think that's the question that we have to answer. First of all, looking at all the evidence carefully, and also based on our discussion with the ministry. And I know there are risks, there are challenges when we are talking about the education of our children. Our education system is critical for the developing mind. We don't want to jeopardize any learning opportunity for our children. So what we can do to better support it, that's the critical piece. And we are trying to find that balance, and we'll continue to look at the evidence and make decisions, recommendations that make sense for our region.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Can you talk a bit more about the vaccine rollout at long-term care homes? What day did that start, and how has the process been going?
So we started the preparation several weeks ago. We had communications, and there are a few pieces to the rollout of the vaccine, because we are using the provincial database and their system, vaccination system, to report the vaccines. So some of the information that the prep work is actually getting lists of those that have consents, and then uploading it to the ministry's system, and supporting these homes with IT supports, and then also actually doing the immunization. So we did start on January 1st, and this some homes have the ability to administer their own vaccine. Others need our support, so we are working with individual homes to provide whatever they need. And so those that are in a position to move forward, it can be a simple, not simple, but a process that doesn't require nurses to go in, but it does require the support of the ministry system, and delivery of the vaccine, and making sure they get the consents, that they have the information they need to get informed consent. So the background work for the long-term care homes is also very, very important, and we need their support. So some homes are able to do the immunization on their own. Others need us to help as well. So every home is a little bit different. So we did 4 homes, January 1st, 2nd, 3rd. Today's the 4th. Today we're finishing up, one of the homes is finishing up the remainder of the residents, and also another home is getting completed by our nursing staff. So we will continue to move forward. We have homes booked already, and we have ongoing communications with all of the homes. We are working as quickly as we can. I would agree. I don't think there's a delay. There are many pieces to this, and people don't understand that, but we are doing the best we can, and are doing a good job supporting the homes. And the homes know that there is a great deal of work on their end as well, and a lot of the homes are in outbreak, and you're not going to be immunizing people that are acutely ill. So there's a portion of that, making sure that we're immunizing people that are well, and there's a health assessment and an assessment that day as well. The expansion of the Moderna vaccine is not only for the residents, but their essential caregivers and also the remaining staff. So those are also people that can be included in this rollout.
Okay, so up until this point, not only residents of long-term care homes, but also staff and their caregivers have been receiving the Moderna vaccine?
So the residents have definitely, and some essential caregivers and some staff. So as you know, the Pfizer vaccine was available and has been, it's still available, and there are many staff booked already through the hospital. But as we're going into the homes, the ministry's has given us direction that we're able to vaccinate their essential caregiver, and as well as any remaining staff.
Any questions from AM 800?
Basic clarification before I ask my question. Teresa, in regards to the deaths at long-term care, you mentioned one was a worker is that the same worker that Unifor reported over the weekend, or is this an additional worker death in Windsor-Essex?
So as far as, I don't know what Unifor has reported, so I'm sorry, but all I know is what is given to me through our epidemiologist, and I was told it is a worker at a long-term care. I will make an assumption that it is the same worker, but I'm not certain, but I'm.
Okay, thank you for that. And now for my questions. Dr. Ahmed, in regards to the vaccine, obviously focusing on homes that are not under an outbreak, but over the weekend, 4 new homes were declared outbreak. If those homes are in the process, staff-wise, of getting the vaccine, and the reason I'm asking this is I actually know an individual that worked at one of the homes that is now listed. She was slated to get the vaccine, I believe, last week. If that home, if the the workers all did not receive the vaccine, does the vaccine stop for a new home that's been listed as an outbreak?
So it's a difficult question to answer, Rob, and I'll try to not to give you a clear answer for the reason that there may be some nuances that we have to look into it. So what happens typically is if a home that immediately goes into outbreak, we need to know the details, the extent of the outbreak, and the exposure that happened in that facility. Unless we get a better handle of where the exposure happened and how many additional staff we are talking about, or how many residents we are talking about, we cannot move forward with the vaccination, because once people are exposed to the virus, and if, let's say, if they're vaccinated, we won't be able to say that if the symptoms that they're experiencing is it a result of vaccine side effects, or if it's a result of COVID, and whether the vaccine at that time would be effective or not. Right now, what we know is anyone who is acutely symptomatic with COVID, the vaccine is not indicated for those individuals. So we need to make those assumptions before we can say, yes, your facility can move on with the rest of the staff immunized, versus the facility you have to wait until we get a better handle. So I really don't want to say it as a blanket statement, but every time then when we are receiving these type of requests, our team do the investigation, bring it forward for me to look at all the details, and then I provide my recommendation. My goal is to vaccinate as many as possible, but I also want to make sure that we are not wasting the vaccine by immunizing people who may not benefit from it, while someone else can benefit from that vaccine. So it's a tough call, but my priority is to vaccinate people, and that we will continue to do.
Okay, thank you. And finally, I noticed there's another school outbreak listed today at George P. Vanier. Can you talk about that? I think people are wondering, how can a school be considered an outbreak if the kids have been out for 3 weeks now? Can you just explain how the schools remain considered an outbreak?
So good question. So one of the things that what we are seeing is, let's say if a cohort was dismissed, and if there was either a staff person who may be on site, and if being on site, if there was any concerns about transmission, and if we establish any transmission link, we have to report it as an outbreak. Sometimes because of all this delay and people getting tested at a much later date, by the time we report that outbreak, all of those things are already happened, and people may not need to take any other additional precautions. But because of our processes and because of our reporting requirement, we do report that, and that's why you're seeing some of that. And the letter, or when we work with the school board to send that letter out, it clearly outlines some of those details about the exposure period, about the risk, and what the instruction is for all those people who are impacted by it.
Okay, thank you, everyone. Have a great day.
Thank you.